COVID is likely making a comeback. Cases of a new Omicron subvariant called JN.1 are rising worldwide. In the wake of the surge, the World Health Organization has urged nations to continue with measures to curb the virus. In India, 142 fresh cases have been reported across the country. The southern state of Kerala has reported the highest number, 115 cases and 1 death. Another death has been reported in Karnataka. The central government has issued a vigilance advisory to all states. Karnataka has now made masks mandatory for all citizens above the age of 60. Among the several nations witnessing the rise, Singapore has recorded 56,000 more COVID cases in the last week up to December 9th. Cases have risen from 32,035 in the previous week. The vast majority of cases are infected by the JN.1 variant. This has prompted the Health Ministry to issue an advisory for citizens and travellers. In Europe, UK is now preparing for a potentially devastating wave. Experts have warned that the new wave here could be one of the worst since vaccines were created. Cases are spreading as immunity levels are waning. Almost 6,000 people have tested positive throughout England in the week up to December 9th. This marks an over 38% rise compared to the previous week. Moving on to Germany, here too infections have reached the highest level since June 2022. The JN.1 subvariant is reportedly responsible for almost a third of cases. While the risk to the general population has been deemed low here, Health Minister has urged people to get their vaccinations topped up. In the United States, 17 states have reported high or very high levels of respiratory illness activity as Covid-19 and other flu hospitalizations have increased. According to the data published up to December 9th, Covid-19 hospitalizations rose to 23,432. An alert has been issued to healthcare providers encouraging them to administer Covid-19 and flu vaccines as soon as possible. Meanwhile, China has detected 7 cases of contracting the subvariant JN.1 in about a month. According to the health authorities, infections in China are at a low epidemic level. However, experts have warned that more cases of the variant are expected. The JN.1 subvariant is a descendant of the BA.2.86 variant of COVID, commonly referred to as Pirola. Symptoms of an infection include fever, nasal discharge, throat infections, migraines, and mild gastrointestinal issues. WION is now available in your country. Download the app now and get all the news on the move.